So here I am today at a friend, colleague, and just a great person in my life, Dr. K. And we're going to put his full name out because once you see how you spell his last name, you'll call him Dr. K also. But our offices are only 25 minutes away, and we became friends. And he's in a similar business as me, except he's a medical doctor. And I love collaborating with a medical doctor if I can. And over the years, that's come and gone, where it's sometimes difficult for chiropractors to make a really strong connection with a medical doctor. I'm starting with me in this video because I've had a lot of injuries, and Dr. Kris K is going to look at my injuries today. You're going to see me get a treatment, and we're going to follow up and see how I do. But he does really cool stuff without surgery that I think you guys are going to find very fascinating to see, and especially see me get worked on. Everything that I need will be probably jumping into today. So let's get cracking.
All right, so Doug.
Yeah.
How are you feeling today?
I feel pretty good. Yesterday I worked on horses. We worked on 7 horses, and believe it or not, it's pretty difficult because I have to deadlift legs and pick up legs and press. So it's very physical, and usually I'm incredibly sore the next day, but today I wasn't. People watch me work on people all the time, but they don't know that I also have had a lot of injuries, both as an athlete. I was a wrestler and a rugby player, and definitely took my bangs and hits over the years.
Treating patients takes a toll.
Yeah,
too.
and tear treating things. Absolutely. Yeah. So let's take a look.
I know that you were diagnosed in the past with a radiculopathy in the cervical spine, which means one of the nerve roots was injured. And if we kind of slice through your neck in this side fashion, we can kind of see your brain and the spinal cord coursing down into the spinal canal. And so what we can see here, I'll zoom in on this one.
That is a disc.
Right, specifically at certain levels. So here's C2-3, here's C3-4, here's C4-5, here's C5-6. So you can see here that you definitely have large herniation that's pushing out. And so we can see as well is the epidural space that you've lost. This white lining is where you should have open free fluid, and you can see it opens back up down here, and it's open up here. But as you get to certain segments, it gets really tight and it gets very close to the spinal cord. And so at C5-6, it's very tight. Right. Level below also.
Now, I don't remember if it was 2017, but that's when I really had my horrible pain time. And for almost 6 months, I barely could use this arm. And I had a lot of atrophy in my forearms. Yeah. So this forearm withered away. Because I have pretty good forearms, they used to match. And do you see the muscle belly here and also the extensor? And this side just withered away. So the diameter is even different. Yeah. And then this thumb, still to this day, it's numb all the time. So this thumb's been numb. I've had loss of strength and weakness. And when I first heard it, I couldn't even do a bicep curl with 1 pound. I could not lift my arm.
Do you see what's going on here? You have a big bulging disc in this disc material that's squeezing this exiting nerve and this nerve over here too.
Would that be left or right?
This is left. This is flipped. Okay, so this is the right side. You can imagine you're lying down face up.
Yeah.
So we're looking at you from the back. And so your left side is very narrow. It's like probably a third of the width over here. That's called foraminal stenosis. And you can see you have a lot of disc material right around here too. And so this little black thing that you see here is the C6 nerve. And you can't really even see it. You can kind of see that it's over here. It's getting pushed around. And so that C6 nerve is really irritated over there. Most people do really well with just traction to those levels. Sometimes you can block nerves to the facets and the joints around it and treat those structures.
But we can work on these two.
Well, we can work on these two for sure. Good. So one of the things that people have developed, not only in the medical field, the veterinary medical field too, is PRP. It's very common in racehorses also. Yeah, and it's common in a lot of orthopedic injuries, wound care.
We've seen a lot of our famous athletes do it too. Right. You know, all our top premier level athletes will do PRP in their shoulders, their knee, their whatever.
Right, absolutely. For a lot of non-surgical treatments for these sports injuries, most of the time people historically just relied on cortisone, which cortisone is a good fire extinguisher. That's the way I like to put it. It's good at knocking out inflammation one time, but it doesn't really help heal things or rebuild things. just like a fire extinguisher, won't repair that house that's on fire. It'll kind of just like knock it out. You kind of have to do something that's more restorative to try to get things to repair. One of the things that people have been using now in the recent future is PRP for the spine, whether it's PRP in the discs or PRP in the epidural space. Both have been shown to be very efficacious with high success rates and even lower side effects than steroids.
So I really want to ask you just a real basic question. I'd love to review it myself because I only know a little bit about this, but also I know that the people that watch my channel will want to know, what is PRP?
PRP is an acronym. It stands for platelet-rich plasma. And what it is a concentration of your blood. And your blood has a whole combination soup of different things in its whole form. So you've got the red blood cells, you've got a lot of iron in those. You've got white blood cells, which is your immune system. And then you got a lot of proteins and plasma in the blood, as well as certain other cell particles called platelets. Platelets are the healing cells. And the plasma is kind of like the solution that your blood is suspended. So one thing that our body does when anything is torn is it heals itself. How? Brings blood there, the platelets get there, and they start to heal. You'll see a scab form, see that coagulation, and beneath it, eventually that pink skin will form beneath it and start to regenerate whatever tissue it's trying to heal. Why don't discs heal? Why don't nerve roots heal? Because we have very low blood supply there.
Right.
And even in most like orthopedic sports-related injuries, like the meniscus in the knee, the rotator cuff in the shoulder, these don't have great blood supply either. And especially after our growth plates close, after puberty. That's why kids don't really get hurt quite the same way we do. They heal pretty quick. They bounce back because they have that blood supply. Once it closes off after our growth plates harden and those structures don't have nearly the same type of feed, they don't heal so well.
And so the concept of this is, if we could just get this healing element in abundance,
yes,
to bathe and surround this area that doesn't get great blood supply and therefore has very slow, or it has obstructed chance of healing.
Yeah.
Bathing it with these platelet-rich plasma gives it a chance to promote healing or activate the healing mechanism.
Exactly. Give it billions and billions of platelets to help send there and start the healing process. That's one of the best non-surgical ways we could treat this. And that's the way your body would try to naturally heal this thing in the first place. And that's just tough for it to get there because of the way anatomy works. So when we take your blood, we'll draw about 80 cc's of your blood. So it might sound like a lot. It's actually a lot less than if you were to donate blood to the Red Cross or one of those blood drives. Usually that's about 500 cc's, half a liter. You're going to give about 80 cc's. We'll put that in a machine called a centrifuge that spins blood and separates it by weight. So the heavy iron-rich blood is going to go to the bottom. That's more for breathing and respiration, oxygen. Don't need that. We need the healing cells and plasma that holds all the platelets, which is the lighter part at the top. So it's going to separate into a yellow and a red lighter.
Yeah.
We'll keep that yellow layer. We concentrate it then again and get it down to whatever volume that we can get into that space in the cervical spine, about 3 cc's. And it's a super concentrated injection of billions and billions of platelets. What research has shown is that if you can get over 2 billion platelets in an injection, you're at a much higher success rate and likelihood to have a successful treatment. So that's how we try to guarantee it. We do a high volume, get it down to low volume and a high concentration.
I'm excited. I'm so glad I'm here, and I'm very grateful that you're going to help me.
Well, you're a colleague and friend, and so it's an honor for you to choose me to do this for you in your journey.
Yeah, I'm at a point in my life where I do have a lot of chronic pain, and I take care of people all the time, but I basically just grit my teeth sometimes or work on days that I am in pain. But I have to take a step back and go, I need to do what's available today, and I love what you're doing. So I'm here today. Thank you.
Let's get this going.
Let's
do it, Doug. feeling good?
Yeah.
Any stingers going down?
I felt it when you first did it down the anterior shoulder.
No. Looks good. It's staying nicely. Perfect. No vascular flow. Looks excellent. All that blood came into this plasma here. Now we're going to constitute it, and there's the platelets that are lifting off the bottom of this canister. I'm going to put this into that same space. You feel any pressure shooting down? Nice. Okay, beautiful. So the man that trained me, Doug, passed away. And the man that trained me, Dr. Greg Lutz, he's the one that passed away. That was my mentor. And so every injection he made me do had to be absolutely perfect. Couldn't miss even a little bit. So that's who trained me, and that's the way I do them every time. Especially for a buddy like you.
Thank you, my friend.
All right, we're taking it out now. That's it. Doug, how you feeling?
Good. I mean, I definitely feel like, I'm trying to think what I feel like. I feel like I'm like a little soreness or something.
You feel a little sore?
Yeah.
Yeah, that's normal.
If I do get sore, will it be tonight or more like tomorrow?
Probably tonight. Yeah. And it might even be tomorrow morning because it's a 12-hour anesthetic I put in.
Okay.
So Tylenol is okay. You can take Tylenol.
Okay.
And then ice and heat alternating is good too.
Okay. Thank you, man.
Was it not too bad?
No, it's not bad at all.
Not too bad. All right, good.
And I didn't take general anesthesia, right? It was
No.
just local. So it was good.
You were up and at 'em.
Yeah. All right,
The whole
thank you
time.
guys. So we finished. Thank you for my juice. I get some little juice. And here's a little straw.
Got it? I opened it.
Oh, there you go.
There you go.
Just
Got it?
pulling it out. So we just finished a few minutes ago and I feel great. It really wasn't painful. I felt the original needle with the local anesthesia prick a little bit. I felt a lot of like achiness through my shoulder, down my arm a little bit, but they said I might even get shooting pains into the thumb or fingers, which I never felt. And now I just feel numb right here. So
Good.
yeah, everything went well. And I'm looking forward to this juice, but I'm worried if it's gonna shoot on me as soon as I poke it. Very good. So it's been 3 months since my procedure, and I wanted to give it some time to really give it a good recap. I'm gonna go over 3 different things right now. First was my experience and my thoughts on this if you ever try it yourself. Second is my results. And third is the type of protocol Dr. Kris and I are starting to formulate from what we've seen. And also we're starting to work with patients now and seeing the results that they're getting. So again, my experience, you can do PRP in the facets, which is what I did. You could also go between the disc, which is a longer recovery from what I've been told. And I found the next day or so, I was just a little sore and stiff, but I was able to go back to work. I've been told if you do the intradiscal going into the disc, within the disc, that you might really want to take a few days off because that could be much more intense. But the way I did it was pretty awesome and really was negligible in the amount of discomfort I had the next day. So the injection itself, you could definitely feel the needle pricking you. And I never liked that, whether I'm at the dentist getting that shot of Novocaine, but I've learned over the years to just steel myself and take it. They do offer the ability to put you out with some type of twilight anesthesia, but I really didn't think I needed it, and it turns out I didn't. The procedure was really fast, and the only thing I really felt was that initial anesthetic or, local anesthesia. So it was really easy, actually. So like I said, I wanted to give a couple of months to really have some space between the time of the procedure so that I wouldn't be still hyped up on the excitement of it. Remember, this was an injury that I did approximately 7 years ago, and it healed to a certain extent, but I still had some weakness, pain, numbness, and some of the things that I've seen now for sure, because I let some time elapse, is my thumb is probably 99% better with numbness. Every once in a while, it feels like a little rubbery or a little weird. But I think that's gone, so that's awesome. I didn't think it would ever heal to that extent. My extensor weakness, which is pulling your hand back, is much, much better. So I got a lot of my strength back that I was missing after all these years. And I use my hands for a living, and I work really deep tissue as a chiropractor. Not all chiropractors work as vigorously as I do. So I really miss that power in my arm, and I've gotten that back too. As far as the neck was never the part that felt the most concern for me as much as my shoulder and whole arm having a deficit. So this is back. My neck feels good. I'm happy. This really worked well for me. So what's evolved from this in the last couple of months is we're excited about a new protocol that has kind of unfolded naturally from this, which is there's 2 great modalities available. There's the PRP, which would be injected into either the facets or the disc, whether it's the neck or the lower back. And we also have the spinal decompression, which could be used on the neck or the lower back. And we now are making tailor-fit custom protocols for the person that's in front of us to see if there's a combination that would maximize results. And that's what it's all about, is putting different modalities together to maximize results and get people better faster.